In keeping with our progression from in keeping with the progression of an infant learning to roll, crawl, kneel, and stand, we're now ready to introduce the kneeling exercises. These occur on one leg, and they're basically designed to achieve stability of one hip articulating within the pelvic girdle. So let's review what we should have done by now. Basic activation of the bike, bridge, and clams to create and activate the muscles along the belt line. Then we went into some alternated quadruped extension from a crawling position to start to tie this belt line into the base of the spine so that it can support the upper part of the box. So we've established a foundation. We're going to continue to strengthen that foundation by resisting rotation. So when we introduce the chop and the lift, what we're going to do is resist the rotation that's being pulled on the band. So we're not going to really try to stress rotation like you might see people in the gym. We're going to try to keep our body stable, which is no movement, while resisting the rotation we're creating with a band. These are very important exercises. They work a lot of the rotational structures that we fail to activate on a daily basis if we live in a profession of sitting, standing. A lot of runners have problems here because they simply run and they don't articulate in a transverse plane. They predominantly live in a sagittal plane, just front to back. People who do unilateral sport rotations like golf and tennis, if they don't practice the other side, will often have a dysfunction here as well. So this is a great exercise for golfers, baseball players, anyone with a shoulder or hip issue, as really what you'll see is that the contralateral or opposite shoulder really articulates across the body and ties into the hip. This, I often will use the metaphor of a bookshelf, where you have the strapping on the back from corner to opposite corner to provide stability to a otherwise open box, which without that strapping or that connected stability, if you were to push on that bookshelf, it would just collapse and lean to a side. And this is very common where you see people having issues all along one side of their body, where one side might be doing more of the work than the other side. So let's get to it. What I use in this office is a Ultra Anchor, available on Amazon.com. I think it was a brilliant design. It causes no damage to the door, but allows for a lot of anchor points, which really facilitates you using regular TheraBands, although I'll be using a functional movement system TheraBand for this exercise, but you can create your own resistance with normal sheep resistance bands. I do use a carabiner that allows me a little flexibility in creating tension or anchoring the band. But a really cheap solution to solving this problem. So let's start with the lift. You can see that I have the band anchored low. I pulled out some tension just by attaching it a little higher. And what you'll see me do is actually come into a 90-degree straight spine, and the band is anchored exactly 90 degrees to me. Now I can change that angle of anchoring until that band starts to come over my shoulder, then it's too far posterior, or I could turn in relation to the band to where it starts to come, a little too far in front of me. So that just allows me a greater variability of challenging different muscles and different angles of my stability. Okay, so I'm going to put my leg in about 90 degrees. And what this actually works is my rear leg or hip. Okay, matter of fact, let's trade sides so you can see it better here. So the band is anchored low. This will be working my right side. I hold the band. I tend to have a palm up grip on the far hand and a palm down grip on the near hand to the anchor point. And I'm simply going to start at the bottom right hip, so the corner of this box that I'm trying to stabilize, comprised of my hips and shoulders. And I have a little tension here, and I'm just going to raise this 1 to my center and 2 up high. Bring it back. Okay, so I do this in counts of 2 with my breath. 1, 2. I'm trying to keep my spine straight, head high, straight ahead, everything square, and I'm resisting the urge of my body to turn with the pull of the band. So 1, 2, I just simply bring my hands as high as my other shoulder and then back down. And I control this motion. I'm not throwing it. If you need to use a lighter weight, use a lighter weight. And this is really working the stability of my right hip into my pelvic articulation. Okay, we're going to perform the chop. The chop is designed to basically articulate the opposite shoulder into the opposite hip, leading to a cross stabilization through reflexive core firing, so that I get some stability on my hip and its ability to hold the frame. Okay, so once again, it's like the bookshelf. If you have a square bookshelf and a lot of weight on it, you don't have strapping from corner to corner, it's very liable to break, fall over, lean to one side, and collapse. So the chop and lift are our primary exercises to accomplish this in the human body. I'm going to avoid chopping into my leg. So I'm going to basically raise and chop over. So the near knee is raised, far knee is down. This hip will actually be getting the results of the stability, the workout. Okay, once again, I can anchor this point here on the wall at 90 degrees, or move it back or rotate my body to get a few different angles of strengthening my transverse abdominis, obliques, etc. But once it starts to go over my shoulder, I've gone too far. Okay, and likewise, I can turn a little bit to the left and start to bring it in front of me, but not too far. Okay, so we'll keep it at 90 degrees for now. You can experiment with what you feel. My hands start palm down on the far side, palm up on the near side. I'll mirror this like you do at home if you have a regular band, so I'll just hold the band itself. I start at my shoulder, and I come to my center on 1. Here I loosen up my grip and let the band slide through my fingers on 2, and I bring this hand in front of this hip. I don't extend it behind me. It's not a tricep workout. It just goes to the hip, the corner of the box. And then this hand, which is at about my heart, punches straight out, creating what I call the bow action, the bow. And this adds a little lever, which creates a more pull, which the word would be perturbation. I'm going to punch this out. That creates a longer lever, making me work harder in resisting this rotation. Okay? So the whole exercise goes from the corner of my box, 1 to the center, 2 to the hip, punch out. Breathe. Back, 2. 1, 2, 1, 2. 1, 2, 1, 2. Own it. Control it. Okay? Couple things. I want my toe tucked under me. I want my stance as narrow as possible so that I have created as much work for my reflexive firing and stabilizers to do. Okay? A little note, if you happen to go into this position and just observe your one-legged stability without standing, okay, and you're wobbling and you feel all this uneasiness, or you start to get tired really quick, okay, that's just indicating the level of instability you have in that down hip. Okay, a lot of people, when I ask them to just get into this position without explaining what I'm doing, they square out like this, they flatten out this foot, and they've created a lot of structural stability because they don't have the muscles in the hip and the pelvic area and the core to actually hold them still. That just indicates you have to do these exercises. Okay, so leg as narrow as possible together. Tuck the rear toes under you. Don't lay the top of your foot across the floor. Tuck them under if you can. If it causes pain, you do it the way you can do it. Stay tall, so if you want to use the pole behind your back to make sure your spine is straight. 1, sorry, it'd be from the right side here. 1, chop over my leg. 2, back out. Okay? That's the chop. All of these want to be done in 10, 20, 30 repetitions. We want slow control motions. We want it done correctly. No need to add speed or weight until you've got a great 10 and 20 down perfect.